So I've got the recording started, Rachel, just so you know.
Say it again, Doug. I'm sorry.
I started recording already, just so you're aware.
Perfect. Thanks. Hi, Dola.
Hello, can you hear me?
I can. Where are you?
The Azores, an island called Fayal. It's 8 o'clock my time.
Oh my gosh. Thank you so much for being willing to come into this.
Of course.
I'm going to get started shortly, but I just want to make sure everybody has a chance to sign in. Doug, I don't know if you know how many people are expected. Probably
We don't
not.
really have a hard count, so
Okay.
I'm gonna say just a lot.
All right. All right. So I'll just listen as other people sign in. Thank you all so much for attending this Major to Career panel hosted by the Center for Career and Experiential Education. My name is Rachel Smith. I am a clinical associate professor in the Communicative Disorders Department here at URI. Just so everybody does know, I know Zoom gives you a warning, but this is being recorded. And I want to actually start by thanking our panelists for coming. We even have people coming from across the ocean to be a part of this. So it's pretty exciting. And I hope that you, as students, you guys get a lot out of this. I want to start by asking all of our panelists just one at a time to please introduce yourselves. Please feel free to share your pronouns as well if you choose, and just give some information about your current position or title. No. Oh, and make sure you're muted if you're not the one talking. So. We also we have some panelists from the professional fields, and we also have Larissa, who is here. She is a current graduate student in our CMD department, and she has agreed to come in and answer some questions as well. So since I started with you, Larissa, you get to introduce yourself first.
Sounds good. Hello, everyone. My name is Larissa. I am a second-year graduate student at URI in the master's program for speech language pathology. I am currently deciding between working with children or adults. I enjoy both. So I'm in my current school placement. So if anybody has any questions about graduate school placements, I'd be happy to answer.
That's fine. I'm Dola Canseco. I am an audiologist, and I am the assistant clinical manager at Rhode Island Hospital, Hasbro Children's Hospital Audiology Department. They are actually also coupled with the speech department, and I have been in the field for over 20 years now, and have a lot of information regarding students we host and opportunities for anyone aspiring to be an audiologist.
She was my mentor during my clinical residency. So she has, she's a great teacher, and she has a lot of good answers. So thank you, Dola. Lori Chung, would you like to introduce yourself?
Hi, I'm Laurie Chung. I'm a speech language pathologist for the Providence Public School System. I'm a URI grad, graduated in '98 from the master's program, also did my undergrad there as well. I currently was supervising a couple of graduate students actually last year. It didn't work out for this year, but I have supervised some students from URI, and I'm happy to be here.
Great, thank you so much, Lori. Haley D'Antuono.
Hi, everyone. My name's Haley D'Antuono. I'm a licensed mental health counselor. I did graduate from URI with my undergrad in CMD and went on to change career paths into mental health counseling. I currently own my own private practice where I work with primarily young adults and some children and adults sprinkled into there. And I recently signed on as an adjunct professor in the Masters of Counseling program at RIC.
You're not here, right? I just want to make sure before I move on. Okay. All right, great. Thank you so much again for being here, panelists. Just to start off, a question, an easy question, I hope, is just tell us a little bit about your career journey after graduation from URI. What position did you actually start in coming from the communicative disorders department? And how did you enter into your role that you're currently in? If you're still in the same role, great. If there were some changes along the way, how did that happen for you? And anybody can just jump right in.
Okay, I'll start. When I graduated from URI, I was kind of how Larissa was saying, between liking working with adults and with children. So I started off in a skilled nursing facility. I lasted 2 months. It definitely was not for me. And so I took some time away from that. I actually started in June. So I had this summer to look for another position. And then I ended up in the schools. I was in the Attleboro school system, which is in Massachusetts. And I was there for about 4 years. And then I just wanted something closer to home in Rhode Island. So I started with the Providence Public School System and was there for about 3 or 4 years. Then I had children. So I took some time off from the field. And then I eased my way back in and I worked for a contract agency. And during that time, I just worked 3 days, 4 days, kind of per diem, and did some early intervention as well as working in the school system. And then once my children were a little bit older, I decided to go back into the school system. And so then I went back to the Providence Public School System. And that's where I've been for the past 13 years. In between then, I also worked at Rehab New England, which was a private practice in the summertime and also through the year, 1 or 2 days after school. And I worked at the Autism Project as well, just doing some social skills groups. And I worked there for about 2 years. And then that was just an after school as I was still working in the school system. And that's it.
So as part of being an SLP, it's never boring. It sounds like you've got a lot of different roles that you play throughout the time.
Yeah, it's definitely a lot of options.
That's great. Thank you, Lori.
I can go next.
Sure, Dola.
All right, so after I received my undergraduate degree, I worked in direct care, supporting adults with developmental disabilities for a few years before deciding to return to URI as a graduate student. And I originally wanted to explore speech language pathology, but then gravitated towards audiology, which actually I find is very common among some of my colleagues. And upon receiving my degree, I worked in an ear, nose, and throat position for 11 years, ear, nose, and throat position office for 11 years. I worked at the VA for almost 8 years following that. And then I've been at Rhode Island Hospital for almost 5 years now. I find that there's just a lot of diversity in the environments, and the only environment in audiology I haven't worked in is private practice. But you do gain a different perspective from each location that you're in. And it's taught me a lot about anything you can experience within the field. Pretty much have seen it so far.
Track in terms of I graduated with my undergraduate in audiology at URI, in communicative disorders at URI, and then I went and worked in the special education field and did a couple of things before I decided to come back, and then ended up actually working with Dola And she's very right that she's had the experience of almost pretty much every single field possible for audiologists.
Right. And I forgot to, somewhere along the way there, I got my doctoral degree.
You just fit it in, right?
Yeah, I fit it in with a 1-year-old and finished up while I was pregnant with triplets. So,
There it is. All right. Thank you, Dola.
you're welcome.
Anybody else?
So I took a slightly different path. So when I finished my undergrad in CMD, I went on to a master's of counseling program at Providence College, which was a different pathway. It was something that I realized I was gravitating towards later in the program, and decided to just finish out my undergrad and move into that in my master's. So I completed my master's there. During that time, I was an intern at the Providence Center, working in their recovery high school and in their partial hospitalization program for adolescents. After completing my master's, I did take a job at the Providence Center. I was there for about 4.5 years. While I was doing that, I received a TAGS from Rhode Island College in advanced counseling, which allowed me to progress into the licensed clinical role. During that time, I stayed at the Providence Centers. I wore quite a few different hats. I worked in an outpatient setting, in a group setting, and I did some home-based work. So there was a lot of different opportunities for experiences there. After completing my CAGS, I went right into a doctorate program, which I completed at Johnson & Wales. It's a doctorate in educational leadership. I really liked the higher ed field as well. So I felt that this was a good way to bridge those two pathways together for me. And during that time, I worked at a private practice. And then after completing that program, I went on to work as a student development counselor at the Community College of Rhode Island. And from there, I opened my own private practice, which I'm currently in full-time now. So.
Haley, thank you so much for sharing that, because I think that sometimes our students and our undergraduate students, they go through this major and they really are just helpers, right? We're in a helping health field. And sometimes SLP or AUD is not exactly the pathway that we want to go into, and which is why I went into special education briefly, why Dola went into mental health care, and then obviously where you are at now. So I think it's really important to let the students know, let you guys know that it doesn't mean that you have to be an SLP, or it doesn't mean you have to be an AUD, that there's a lot out there.
Yeah, and I think that was something, it definitely created a little bit of anxiety as I was finishing up, but as I explored those options and what that looked like, and I mean, I credit URI staff for helping me kind of navigate a lot of that as well, and what those next steps would look like for me. And then kind of reaching out to different programs that were encompassing more of what I was looking for really helped to get me to that pathway.
That's great. So we do have some chats going on. We are going to have some question and answer time at the end. Absolutely, students. So I would love to have you guys have some questions. Either you are able to chime in, just kind of speak up, or you can write your questions in the chat. Lori would just actually responded to a question. So a question was, what's the highest paying work environment for an SLP, a private or in a private practice? And Lori's response was, it can vary. She's seen job postings lately from a range from anywhere from hourly rates of $45 to $70 per hour. So just to kind of follow up on that question as I saw it come through, Lori, thank you for answering that. I think Haley, I almost kind of know some of your answers to this, but the next question, and Larissa, this kind of applies to you as well. Are there specific skills, work experiences, or academic coursework that can make students more competitive for positions within the field, or your, the organization. Feel free to speak to any internships or volunteer work or courses that you found to be most beneficial. And Larissa, I know you're kind of ending up your studies, so you may have experienced something, or if there was something that you did in undergraduate that you found helped you, courses that you did in undergraduate that really pushed you forward or helped you in your graduate student search, your graduate school search.
Yeah, I'd be happy to answer that. I come from a psychology background, so for anybody who maybe not majoring in CMD or audiology, but still wants to go into this field, so it is possible. So I think that actually having that psychology background, kind of having that different perspective did help me, because it's like a different perspective on how to look at, speech pathology. So I think that's one thing. I think your placements in your graduate school also help with jobs. Like this summer, I'll be at the VA, and that's something that's, competitive position to get into. So I think that'll be something that will help with jobs. I think also just the way your confidence, the way you present yourself when you're interviewing, even for graduate programs, just saying like, this is what I know, but this is also what I don't know, recognizing what you don't know, but also being confident in what you do know, especially when you're applying for jobs. I guess it's a little bit more for when you're applying for jobs like after graduate school. But again, just having that confidence, having passion about, the field, and having kind of like your niche. Just, I know you kind of discover it as you go on, but having something that like motivates you about the field, like, why am I in this field? For me, it was like really important to have like access to bilingual services. Like, I think that's something that's really important. So that's something I mentioned in my essays applying to grad school, something that I mentioned in my interviews. And that was kind of like what was important to me. So having that kind of interest of why you're in the field, that your niche, and starting to kind of figure that out slowly is really helpful too.
I think for me, one thing that I reflect on often, especially when I was doing more home-based work, and I was in the school systems a lot more working with their teams, is having a little bit of the background on the speech language pathology side of things, especially with working with students who had various needs, was really helpful. I know in my undergrad, I did quite a few hours of work shadowing the SLP at Meeting Street School, and even knowing a lot of the techniques and remembering a lot of the things she was using and being able to incorporate them within the mental health side as well, whether it be visual aids, different things like that. So you're really learning to meet your clients where they're at. So I felt like the skills that I learned in this program really were transferable into more of that mental health field. I think if you have the opportunity to take an internship at any level, take it. I think it gives you so much experience. It really gets your foot in the door. You can read it in textbooks, but getting your feet wet and really getting in there, I think, is where you really gain that insight and experience and start to understand what you like about the field, what areas you feel like aren't maybe your specialty areas. And so I feel like just really putting yourself out there and taking what's offered and seeing what's out there and experiencing it was one of the best things I did for myself once I started to move into that master's program. The other, and I guess this would speak more to once you're in that job search, the other piece is with the interview skills, kind of going off of what Larissa said. I think interviewing often and interviewing for positions that even you may not think you're going to love, but you learn a little bit about and you get some information on what those positions look like. I think it's great practice in the field. It's also great to learn about different areas. And sometimes you move into those roles that you never thought you would end up in once you start to learn a little bit more about that. The only other piece of advice or suggestions, I did a lot of informational interviewing as well throughout my time in my master's program, reaching out to a lot of different professionals in different areas of the field and seeing if I could just sit down with them and talk about what their day-to-day looks like to gain better insight into that. And I felt that that was something that really helped me navigate what I was looking for and just learn more about the field in general.
Same types of things that Haley and Larissa are saying, just finding opportunities to shadow. It doesn't even necessarily need to be an internship, but reaching out to, clinicians in the field, to maybe spend, a day with them for a couple of months or, even a month, just to kind of get a sense. You can use, if you're in Rhode Island, using the Rhode Island Speech and Language Pathology Association, to find SLPs to try to make that connection. And, I know there would be tons of SLPs out there who would be willing to just have you come in. I know I did that as well as an undergrad. I did some at some hospitals that were close to me in the summertime just to get a sense, because you really don't know. You can take, as an undergrad, you're taking these classes and it's really hard to really get an understanding until you're, in graduate school. And, oftentimes you don't necessarily, I don't know how it is at URI now, but we didn't get to pick our placements. We were kind of placed where we were placed and you just kind of went with it. And so sometimes you don't necessarily, I personally didn't have, I had a hospital experience, but it was a different type of hospital. It was a long-term care hospital. So I didn't get that acute care experience, nor did I have the skilled nursing experience either. And I think when I went into that right out of school, it was kind of shocking for me because I didn't have that experience. So maybe if I had, shadowed there, it would have looked differently. So as much as you can, try to just make those connections.
Just put up in the chat a link to that Rhode Island Speech and Hearing Association to get some information. So if you see that there, the link is there if you want to look into that, what Lori was just talking about. I'm the moderator, but I'm also an alumni, so I feel like I get to chime in just a little bit, right? When I was in graduate school, I thought speech pathology, SLP. And then I realized graduate school, I wasn't ready for that. And that's when I went out and I was a teacher and I was seeing different populations. And I thought, oh, I love kids. So, all right, I'm gonna do kids. And I loved my students. I absolutely did. I worked through the Groden Network. If anybody has ever, students in my class, you hear me talk about it all the time, but Groden Network was a great opportunity for me to learn a little bit more, not just about the field, but also about myself and what I was ready and able to do. And then when I went to graduate school, I said, oh gosh, pediatrics is the best. Kids are so cute. And then I had my first pediatric placement for diagnostic testing. And I was like, oh, I don't know. I don't enjoy this at all, right? And I thought I did. And I think kids are really great. But getting those experiences and actually learning where your skills are or where your passion is. We talked about passion a little bit. I think that's also that's really, really important. And now I see kids, but maybe not so much as the adults. And I know Dola, having worked at the VA, probably very similar, where the VA, you don't get any pediatrics there, right? And so you find where you feel most comfortable. Okay. There's another comment: for anyone who isn't from Rhode Island but went to school at URI, did you get a job, position, internship in Rhode Island or the state you were originally from? The student in particular is from New York. I don't know if anybody here is from out of state originally.
I was from Massachusetts and I went to URI, and so I did all of my placements were in Rhode Island, but when I did some of the shadowing, I did it back home in Massachusetts. I know one of the graduate students that I had last year, she was from Massachusetts, but she was moving to New Jersey and she was able to get a job in New Jersey. And I think she did most of her interviews. They were just phone interviews and or Zoom. She didn't actually even go out to New Jersey, and she was able to get a job before she graduated last May.
I also have had some students from out of state. And one of the things that we caught kind of late in the game was that you should really look into the licensure requirement from the state with which you plan to practice once you graduate. Because I know Massachusetts requires you to fill out paperwork before you start your externships, or and we didn't realize that, and we missed that opportunity. So different states have different requirements, so you may want to look into that and see what those are when you're planning wherever you go for your education or your externships or internships.
So, and Larissa, you might be able to speak to this a little bit, but or give a little bit more information. Any of the CMD students on here, you know, I think which is all of you, you know that you will take clinical methods, which is 465, and you will be required to do observation time, and it's 25 hours of observation, which sounds like a lot. But what we're talking about, and this is your future, right? So you know, doing some of that extra, okay, you're not going to get credit. You know, you're not going to get credit if you go home on break and actually, you know, go observe an SLP or an AUD, or somebody in the mental health field, or you know, any of that. But really, these are your opportunities to get a little bit more information than just maybe observing you know, a case study on the, you know, online, or actually, you know, observing in our clinic behind the glass. You're actually able to interact with that clinician and really get an idea of what's, you know, is this something that's for you? Larissa, I don't know if you have any more to add about your internships or your work currently.
Yeah. So yeah, right now I'm a GA or TA for CMD 465. And right now, yeah, the hours are master clinician. Those are the required hours. But we encourage all students to do outside observation for that exact reason that you said, Dr. Smith, because being able to see in real life, you know, in real time what the SLP is doing, asking them questions, you know, you can ask them questions about their job and, you know, how they balance everything, how they balance a caseload. And, you know, you can't do that if you're watching a video online and you can't interact with the speech pathologist. And I know for me, when I was observing, I did some telehealth observation as COVID was still kind of going on. And I also did some in-person observation. It was just such a good experience for me to see what do you actually do in the day-to-day. Like a lot of people mentioned, it's one thing to sit in a class and say, okay, this is what the theory is, this is what theoretically I'm supposed to do. But then when you're actually watching someone do it, or, you know, in grad school, like actually doing it, it's a whole different experience. So yeah, I definitely recommend observing. You can observe, yeah, like if you're out of state, you can observe in your state over break. I'm from New Jersey, and again, with the licensing thing too, that's something I'm going to be considering also when I'm applying to jobs. So those little things that you kind of have to think about. It just depends when you're getting the job or the internship. If it's over the summer, you can certainly do it at home, since you'll probably be at home. But then again, if you're, you know, here during the school year, you might want to do one here. And also depends where you want to go after. You know, where you want to have a job eventually. So if you want to eventually work in Rhode Island, maybe you can do more observation in Rhode Island, make those connections with speech pathologists in Rhode Island. But if you plan on moving back to your home state, then you could, you know, start making those connections with speech pathologists in your home state, because that'll be an asset for you later on. You'll already have someone, you know, you can kind of reach out to.
Ask, what have you done outside of the requirements of 465? Because I want to know, what are you actually pursuing this? Are you actually looking into this a little bit more than just what is required? Because again, this is where you're headed. Great, Larissa, thank you so much. Erin asked a question in the chat. I don't know if I have a good answer for this, but I'll ask it anyway. Maybe someone can help. We talked a little bit about education. Erin is a double major in early childhood education and CMD, and is wondering if it's possible to graduate with just a degree in education major and a CMD minor, start working as a teacher while getting your master's in CMD to become an SLP later on. Maybe, unless one of the SLPs has any advice on that, Larissa, do you feel like you would be able to work as a teacher full-time and then be able to get your your master's in SLP on the side.
Yeah, I'm glad you said something. I was just gonna say, I would not recommend it. It is, graduate school is very intense because not only do you have classes, so your first semester, you just have classes, but then, right, at least at URI, your second semester, you already start with your placement. So not only do you have to be there for classes, a couple of times a week, you also have clinic placement to prepare for, to be there for weekly. And then eventually you have your off-campus placement where you're gone, most of the day. Like I have school placement now 3 days a week, and I'm there, 8:30 a.m. to 3:30, and I go straight to class at night. So there's not really time to do, to get like do a full-time job. A lot of people obviously do part-time jobs because it's, you're in grad school, you need money. So a lot of people do part-time jobs, but I would not. It's kind of hard to have a full-time job, work full-time as a teacher while being in graduate school. It does take a lot of your energy and a lot of your time. So.
Yeah, I mean, I don't know if the program's changed. I graduated a long time ago in 1998, and I was going to say, yeah, I wouldn't recommend that either. It was definitely intense, and I'm sure it's just as intense, if not more. Now it's definitely, a full-time job. I mean, I was in school at the time, and there were students who, had families and were older, and they were able to manage that, but not without a lot of stress that came along with it. So if you're able to not do that, I would say definitely don't.
I think it's a great idea to have some doubling of the skills, and I think it's wonderful to have both the education and the CMD because they certainly go hand in hand, but not potentially moving forward. That's not saying it's impossible, but that would be a lot of work. So I agree. Just
Rachel, I'm unable to hear you right now. Not hearing you.
okay, I should be back. Am I back?
No, I can hear you.
Okay, yeah, my son took over my AirPods, so I was listening to him talk from the driveway. So I apologize for that. One of the next question I was going to ask, if I cut out again, I apologize. But more than 2/3 of job seekers today are saying that diversity and equity and inclusion are important factor in their decision to accept a job offer. Can you speak to your organization's commitment to these initiatives? If anybody has any information about that or any insight?
I can say Rhode Island Hospital is actually working on an initiative for certification for LGBTQ. We've just received signage for gender neutral bathrooms. All employees are required to complete diversity training through our Net Learning platform, which is our annual educational platform, in addition to other cultural and diversity trainings. So every employee is required to complete diversity training every year.
So Providence Public School System is spearheading efforts to recruit educators of color and offering different incentives. surrounding that in terms of, pay and loan repayment, things like that. I don't know the exact details of it, but they're really trying to have, faculty and staff reflective of our students. So they are trying a big outreach with that. In terms of SLPs, that's really more, at a national level. We have to do a better job in terms of being able to, recruit and retain SLPs and audiologists of color. So I think that that's something that ASHA is hopefully working on. But in terms of Providence schools, they are trying as well.
As a solo practitioner in my private practice, I do try to make sure that I'm attending trainings multiple times a year, usually on diversity and culturally sensitive practices, just to make sure I'm up to date on the data. I also am part of a network called ALMA, which is a providers network that allows for discussions, definitely like case consultation, all of that with providers across the country. So to be able to meet with them and talk with them about different cases, different areas that I may not have as much background in, and continue to learn and grow in those areas is something that's very important to me. And definitely networking with providers of different backgrounds in the area to be able to really refer clients appropriately and as needed. If someone is more comfortable with a different language, I rather refer out to whatever that home language is and what they're comfortable with than take them on and try to make it work. So that networking piece is really important and part of how I work to attain those goals.
At URI, almost all of our classes, we talk about cultural competence. We talk about how to work with culturally diverse backgrounds, especially if it's different from your own. So I've definitely seen it in my classes. It's always incorporated. And you also have to take a class called cultural linguistic diversity in CMD. I think that's what it's called. So you take a whole class about it. And so that is also another way that they're working through it. And it kind of like teaches you, and you're working through like different perspectives. If someone comes with you as a client, they have a different cultural perspective, and we really need to honor that as speech pathologists, especially because we're working on communication, which is so important and so tied to culture. And, so it's really important that we learn it. And I'm really glad that I've had that incorporated in all our classes.
That's good to hear. Coming from a perspective of working in an urban school district, and just the use of the word disability in various cultures is just viewed so differently. And I've just learned that myself over the years, as well as just doing, my own research. But it's definitely really important to know about that, working with students who may be Native American or students who are from different backgrounds than yourself, and just knowing how you're delivering this news to parents, and it really, you need to be able to take their perspective. So I'm glad to hear, because when I was at URI, we did not have that class. So
I also want to add, at Rhode Island Hospital, we serve a very diverse patient population. And interpreter services are available for almost any language you can encounter. They have an iPad that you can select the language and participate in video interpretation. And, and they're always looking for bilingual or multilingual providers. And there's certification processes for those individuals to provide services that are bilingual.
Thank you for saying that, Jill. I was just going to say a similar thing, that in this field, in any healthcare field, if you are bilingual, trilingual, you are very marketable. You have a skill that is really going to help you connect directly with your clients or patients, how you are, or your students. So consider, working with that. And I know some of our students are actually maybe not bilingual by culture, but are learning, Spanish to actually help, or ASL. I know a bunch of students are taking the ASL courses as well. That gives you a leg up in this field for sure, and helping your clients. Lori, you're hitting all the points here. It's great. A student asked about insurance, whether insurance is accepted in a private practice, or is it private pay? And the answer is it really depends on what the practice accepts. There are a lot of private practices now that are avoiding insurance altogether because it's very hard to, maybe Haley, you could say something about that. It's hard to get insurance companies to pay for things. I don't know if you have anything to comment about that as well.
Yeah, insurances, it gets tricky sometimes. It's really wonderful because it allows a broad array of clients to be able to access your services. Accessibility is something that I think is really important. And on the other side, on the provider side, sometimes it really limits what we can do with the patient in front of us, because it's a lot of what we're doing is then dictated by whether insurance is going to approve it or reimburse it, or how many sessions they're going to cover and what services at that time. So I feel like it's sometimes a little bit of a double-edged sword, because you want to make your services accessible. And on the other end of things, you also, at the end of the day, you're doing this as a career, you need to make a livable wage as well. And so I currently do accept insurance, but I know the private practice I was at most recently prior to opening my own practice is starting to move away from that. And we are seeing more providers take a step back from that.
Yeah, I have my sister-in-law is an SLP, and she does not accept insurance, but her wife is a PT. She does not accept insurance, so it goes to the patient. However, right, the services that they're able to provide are significantly, I think, more betterer than without. But so there's a couple of there are two sides to that. Clearly, a hospital would accept insurances. We at the speech and hearing clinic, we accept insurance as well. So another question was about getting clinical hours to become a speech language a pathologist assistant, an SLP assistant, and there's an AUD assistant as well. Lori was happy to answer. You can try and contact Risha, the Rhode Island, the link that's already in the feed. I don't think Rhode Island does have a certification for SLPAs, but Massachusetts apparently does, Lori says. I know the American Speech and Hearing Association, ASHA's website, has information about SLP assistant and AUD assistants. I'm trying to think. I know that Nova Southeastern, Nova in Florida has an AUD assistant program. I don't know about the SLP specifically. Lori, I don't know if you had any other information about that.
No, I don't. I know that a while back when I did actually work for one of those contract agencies, I worked in Massachusetts and I had a speech assistant. And so that's the only reason why I knew, but I don't know too much about it just because Rhode Island, we don't have that.
Yeah. And so the question comes into if you can, where you can actually get the clinical hours. Wasn't sure if I should be doing my clinical hours in Massachusetts. So this particular student, Vanessa, is actually looking for that SLPA. I would take a look at the rules that we talked about before in terms of licensure and what the state's differences are. So I would probably agree that you might have to get those hours in Massachusetts, but I'm not 100% sure.
You could ask the Massachusetts Hearing Association. They might be able to answer your question. That's like a smaller organization than like ASHA to like kind of reach out to. They might be, willing to like answer an email or something if you like look up Massachusetts like Hearing Association. They probably have one. So
that's why we keep Larissa around. She's very smart. She comes up with good answers. All right. Well, here's an easy one. what do you find most rewarding and most challenging about your current role?
I think for me, what I find currently most rewarding is being able to see people take what they think is small steps to make that bigger progress, and really watching them start their healing process and seeing like what that looks like for them and them maneuvering through that. That's probably one of the most rewarding parts, is when you really start to see those incremental steps towards progress. One of the challenging parts, I think, of my job in particular, is really trying not to take it home. And this is something that I've tried to work on since I've been in the field. And it's one of those things that when you're working with people and humans and they're sharing their most personal stories, it's hard to sometimes leave that at work and at the door and not take that home. And so really working on that separation and leaving work at work and moving throughout your day once you're home, because some of the stories and people's kind of journeys, they impact you, and they're really powerful, and they're true to them and their experience. So
I would say most rewarding is kind of to piggyback off of Haley as well, is when you're able to discharge kids. For me, it is challenging. I do have a large caseload, but there is progress, and seeing those kids being able to discharge them and go on their way is definitely the most rewarding. Also, just getting buy-in from team members. I do work in the classroom a lot with teachers. I also do a lot of co-treats with my OT and CODA in my building. And so when you get feedback from team members or teachers in terms of maybe strategies or techniques that you've implemented with some students, and they're using them, and they're seeing some of that progress, that tells me that it's working. And so that's always really rewarding for me. In terms of challenges, there are a lot of challenges in working in an urban school district with large caseloads. But in general, being a speech pathologist in a school, specifically, a large urban district, you're really expected to know it all, and you don't know it all. I'm still always learning. I haven't had a student who had disfluencies in probably about 6 years, and I just had a student this year. So I had to go back to some journal articles, and I had to go do some CEs just to kind of look at new techniques and things like that. So you see a wide range of student needs and challenges and disabilities, and you don't know it all. I've been in this field for a while, and I still don't know it all. So that can sometimes be challenging, but it also can be rewarding, because you do need to learn new things, and it keeps you on your toes. You're just always learning in this field. So no matter what, I know your licensure, you have to do a certain amount of hours, but it's like you need to do it because things are always changing, and the way that you're approaching communication differences is always changing. So, and paperwork. I got to be realistic. Paperwork is no joke. And that's, you're going to learn a lot. You're going to learn all the book stuff in school. But if you do a placement with me, you're going to learn about the paperwork, because that's one thing that I didn't have tons of training with. And sometimes your indirect work is a lot in the schools, and just being able to find that balance between, sometimes you wonder, am I giving enough to these students, or am I doing paperwork? And you just have to be organized, and you do figure it out, but it's definitely challenging.
I can piggyback on what Lori said about paperwork, because there is a lot of documentation, a lot of challenges related to coding for reimbursement for insurances, and it's not black and white. There's a lot of gray in there, and that certainly is a challenge. Also, working in a hospital environment, we work with both pediatric and adult patients, and it's a challenge to see things you don't want to see. We work with children with the Tomorrow Fund Clinic to monitor their cancer treatments aren't damaging their hearing. We work with individuals who've undergone trauma, as well as individuals, lots of pediatric children, lots of children referred to us through the Child Neurodevelopment Center. In our main clinic, we're 75% pediatric, 25% adult, but we also provide services in another building that supports the ear, nose, and throat clinic, which is 75% adult and 25% pediatric. So in our clinic, we do get to see quite a bit. What's rewarding, and actually I'll go back to something Rachel said. You may get in a day and you may have 8 hearing tests on 2-year-olds. And out of those 8 2-year-olds, probably 6 of them scream as if you're trying to take blood from them. They may kick you, they may, thrash about, and you may be their worst enemy. But at the end of the day, you're making a difference. You're finding out, can that child hear? Is that child's hearing adequate for their speech and language development? And if they can't, we're on the front lines. We're one of the only 2 pediatric locations in the state that can then provide intervention for children. Everybody sees those videos on the internet where you put hearing aids on a child and they're hearing for the first time. Well, we get to experience that. We get to see that child's reaction. And at the end of a long, hard day, whether it's a child, I've had adults who've cried and said, "You've changed my life." So at the end of the day, we are making a difference. And on those hard days where the paperwork's overwhelming, the documentation's overwhelming, what you've seen is overwhelming, at the end of the day, you are making a difference, and that does make it worth it.
Dola, thank you. Thank you, Lori. Thank you, Haley. Thank you, Larissa, for joining in. We do have to wrap up the session. If any of you have further questions for our panelists, we have ways of, specifically for them, if we have ways of being able to get in touch with them. You can reach out to, well, 99% of you are my students, so you know how to get me. So we can figure something out. Thank you again for sharing your time, and I hope for the students' sake that you guys got some great information about, got some good answers to some of your questions, and feel confident about moving forward in this profession. Okay. Doug, I don't know if you want to take it away or if you have anything else you wanted to say.
On behalf of our office, I want to thank everybody for your time. You were a lot of help. You answered a lot of questions that students always ask me. You also validated a lot of things that I tell students, which is always nice as well. So thank you for joining us, and thanks to all the students who took their time to be here today on the first really gorgeous day in Rhode Island this year. Thank you for being here.
Emails directly in the chat. So if you would like to reach out to anybody, their emails are there. And if anybody else wants to add, we have like 1 more minute before Doug has to shut down the meeting, because this man's got more meetings today than anybody.
Definitely reach out if anyone has any questions. I'll be more than willing to chat with you. If anyone's looking for, a mentor or just, anything, I definitely will respond. So feel free. Thank you.
Wonderful. Thank you so much,
Absolutely.
everyone.
Thank you.
Thank you.
Thank you.